Good afternoon. My name is Brandon Hicks, and I'm going to teach you how to take your subject's blood pressure. The equipment you'll need to take someone's blood pressure will be a sphygmomanometer and a stethoscope, as shown in the video here as well. We will be using a traditional pump sphygmomanometer today. Steps before taking your patient's blood pressure. The patient should sit quietly for 5 minutes in a chair with back support with both feet on the floor. The patient should also never have their legs crossed. The left arm should also be supported by an object at heart level. The hand should also be relaxed and not in a fist to get accurate readings. You also want to make sure the patient has appropriate clothing, which is a short-sleeved shirt. This is important to reduce the risk of a blood pressure reading. The patient shouldn't smoke or drink caffeine 30 minutes prior to the test as well. Here's our subject seen relaxing. It's time to put the cuff on the subject. You should make sure the cuff is the right size, where the cuff wraps around 80% of the upper arm. Once the appropriate size is selected, align the cuff with the brachial arteries. There needs to be about 1 inch from the elbow and the cuff. Using the stethoscope, make sure the prongs are facing forwards and not backwards as shown in the video. Reading the cuff and taking your patient's blood pressure. Place the stethoscope piece below the arteriocubital space over the brachial artery. You will begin inflating the cuff to 180 millimeters of mercury per second. When it reaches this limit, slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury per second. The first reading you'll receive is the systolic blood pressure, which is the first phase where the first 2 Korsakoff sounds are heard. The next reading you'll receive is the diastolic blood pressure, which is the last phase. It is important to go by the sound and not the jumps of the needle. The jumps of the needle can give you inaccurate readings as you are listening for the Korsakoff sounds. The pump is pumped to 180 millimeters and the valve is slowly released as I listen for the Korsakoff sounds. You should get 2 measurements from your patient in case of errors and take the average of the 2. After this is found, provide your patient with the results verbally and written and compare the results.